Question 1. The exchange of gas in the lungs takes place by A. Bronchioles, B. Alveoli, C. Trachea, D. Bronchus. And the answer is B. Alveoli. Question 2. The function of cerumen, wax, is A. Protect the ear, B. Help clean ear canal of foreign matter, C. Protect ear canal from water damage, D. All of these. And the answer is D. All of these. Question 3. The causes of the high birth rate in India are all of the following except A. Early marriage, B. Traditional customs and habits, C. High level of literacy, D. Universality of marriage. And the answer is C. High level of literacy. Question 4. A pictorial diagram of frequency distribution which consists of a series of blocks is called A. Line diagram, B. Pie chart, C. Histogram, D. Frequency polygon. And the answer is A. Line diagram. Question 5. The part of the brain which controls body temperature is A. Thalamus, B. Hypothalamus, C. Pons, D. Medulla oblongata. And the answer is A. Thalamus. Question 6. Glucocorticoids and mineralocorticoids are secreted by A. Pancreas, B. Gonads, C. Hypothalamus, D. Adrenal glands. And the answer is D. Adrenal glands. Question 7. Substantia nigra secretes which of the following major neurotransmitters? A. Adrenaline, B. Dopamine, C. Serotonin, D. Noradrenaline. And the answer is B. Dopamine. Question 8. The principal cells of the epidermis that produce keratin in a complex process are A. Melanosomes, B. Keratinocytes, C. Melanin, D. All of these. And the answer is B. Keratinocytes. Question 9. The total number of bones found in the right upper limb is A. 25, B. 30, C. 40, D. 60. And the answer is B. 30. Question 10. In the following which are both endocrine and exocrine glands? A. Pituitary, B. Thyroid, C. Pancreas, D. Adrenal. And the answer is C. Pancreas. Question 11. The anatomical term for the breastbone is A. Sacrum. B. Sternum. C. Patella. D. Clavicle. And answer is B. Sternum. Question 12. The aim of the National Strategic Plan is to eliminate tuberculosis by A. 2025, B. 2030, C. 2035, D. 2040. And answer is A. 2025. Question 13. The lowest layer of the atmosphere is A. Stratosphere, B. Troposphere, C. Mesosphere, D. Ionosphere. And answer is B. Troposphere. Question 14. Which is the largest nerve in the body? A. Sciatic, B. Peroneal, C. Pudendal, D. Tibial. And answer is A. Sciatic. Question 15. The increase in urban population is due to all of the following factors except A. Employment opportunities, B. The attraction of better living conditions, C. Availability of social services, D. High mortality and morbidity. And answer is D. High mortality and morbidity. Question 16. The literacy rate taking into account the total population in the denominator is termed as A. Effective literacy rate, B. Crude literacy rate, C. Life expectancy rate, D. None of these. And answer is B. Crude literacy rate. Question 17. The number of new cases occurring in a defined population in a specified period of time is called A. Prevalence, B. Incidence, C. Secondary attack rate, D. Point prevalence rate. And answer is B. Incidence. Question 18. An epidemic usually affects a large proportion of the population, occurring over a wide geographic area such as a continent or world is called A. Endemic, B. Sporadic, C. Pandemic, D. Exotic. And answer is C. Pandemic. Question 19. The ratio of the incidence of the disease among the exposed and the incidence among the non-exposed is called A. Attributable risk, B. Relative risk, C. Population attributable risk, D. All of these. And answer is B. Relative risk. Question 20. The time interval between invasion by an infectious agent and the appearance of the first sign and symptom of the disease is called A. Serial interval, B. Incubation period, C. Latent period, D. Communicable period. And the answer is B. Incubation period. Question 21. The main purpose of a vaccine vial monitor is to A. Ensure safe transport, B. Prevent damage to vaccine, C. Ensure heat-damaged vaccines are not administered, D. Easy administration. And the answer is C. Ensure heat-damaged vaccines are not administered. Question 22. The person, animal, object, or substance from which an infectious agent passes or is disseminated to the host is called A. Reservoir, B. Source, C. Carrier, D. Latent infection. And the answer is B. Source. Question 23. The changes that occur during the second trimester in the fetus are all of the following except A. Fetal heart sound can be heard with a stethoscope, B. Skeleton is calcified, C. Eyes remain closed and body growth accelerates, D. Lightening occurs. And the answer is D. Lightening occurs. Question 24. A woman's serum and urine will test positive for HCG in all of the following conditions except A. Pregnancy, B. Ectopic pregnancy, C. Vesicular mole, D. Post-hysterectomy. And the answer is D. Post-hysterectomy. Question 25. Transmission of maternal antibodies to the unborn child through the placenta is an example of A. Active immunity, B. Passive immunity, C. Humoral immunity, D. Herd immunity. And the answer is B. Passive immunity. Question 26. Failure of descent of one or both testes at birth in the newborn is called A. Phimosis, B. Hydrocele, C. Cryptorchidism, D. All of these. And the answer is C. Cryptorchidism. Question 27. Complications during pregnancy and childbirth can be prevented by A. Skilled care at birth, B. Early detection of risk, C. Appropriate and timely management of obstetric complications, D. All of these. And the answer is D. All of these. Question 28. White or yellowish-white secretions that last for 10 to 15 days after delivery is called A. Lochia rubra, B. Lochia serosa, C. Lochia alba. D. All of these. And the answer is C. Lochia alba. Question 29. The main components of essential newborn care are the following except A. Resuscitation of a newborn with hypoxia. B. Prevention of hypothermia. C. Prevention of infection. D. Prevention of behavioral problems. And the answer is D. Prevention of behavioral problems. Question 30. Recommended volume expander for a neonate in shock is A. 5 milliliters per kilogram of normal saline. B. 10 milliliters per kilogram of normal saline. C. 15 milliliters per kilogram of normal saline. D. 20 milliliters per kilogram of normal saline. And the answer is B. 10 milliliters per kilogram of normal saline. Question 31. The diagnostic techniques used to detect congenital anomalies in utero is A. Alpha-fetoprotein. B. Amniocentesis. C. Chorionic villi sampling. D. All of these. And the answer is D. All of these. Question 32. The minimum interval between two doses of TT vaccine given to antenatal mother should be A. 1 month. B. 2 months. C. 3 months. D. 4 months. And the answer is A. 1 month. Question 33. Babies who are at high risk of developing retinopathy of prematurity are A. Preterm neonates. B. Term neonates. C. Postterm neonates. D. All of these. And the answer is A. Preterm neonates. Question 34. Vitamin A supplement is given under the Reproductive and Child Health Program for children up to the age of A. 1 year. B. 3 year. C. 4 year. D. 5 year. And the answer is D. 5 year. Question 35. Measles, mumps, rubella vaccine has to be given A. After birth. B. After 3 months. C. After 6 months. D. After 9 months. And the answer is D. After 9 months. Question 36. At the healthcare facility, health workers can adequately protect vaccines by all the following measures except A. Keep vaccines in appropriate vaccine refrigeration equipment. B. Use of temperature monitoring device. C. Transport vaccines in a vaccine carrier. D. Store vaccines in the door of the refrigerator only. And the answer is D. Store vaccines in the door of the refrigerator only. Question 37. The route of administration of the Salk polio vaccine is A. Oral, B. Intramuscular, C. Intravenous, D. All of these. And answer is B. Intramuscular. Question 38. The vaccine for yellow fever is A. Salk vaccine, B. 17D vaccine, C. CHO vaccine, D. PREP vaccine. And answer is B. 17D vaccine. Question 39. The following vaccination is included in the National Immunization Program. A. Vitamin A, B. Vitamin B complex, C. Vitamin D, D. None of these. And answer is A. Vitamin A. Question 40. The target groups of weekly iron folic acid supplementation, WIFS, are A. School-going adolescent girls and boys in 6th to 10th class, B. School-going adolescent girls and boys in 10th to 12th class, C. School-going adolescent girls and boys in 8th to 12th class, D. School-going adolescent girls and boys in 6th to 12th class. And answer is D. School-going adolescent girls and boys in 6th to 12th class. Question 41. The components of adolescent health programs are all except A. Weekly iron and folic acid supplementation, B. Adolescent reproductive and sexual health program, C. Menstrual hygiene scheme, D. Vitamin A supplementation program. And answer is D. Vitamin A supplementation program. Question 42. What is the first sign of puberty in females? A. Voice changes, B. Axillary hair, C. Breast development, D. Menarche. And answer is C. Breast development. Question 43. The dosage of tab, albendazole administered to prevent Hellman's sensation in adolescents is A. 200 mg, B. 400 mg, C. 500 mg, D. 600 mg. And answer is B. 400 mg. Question 44. The Menstrual Hygiene Scheme, MHS, was implemented for adolescent girls in the age group of A. 10 to 22 years, B. 10 to 19 years, C. 16 to 19 years, D. 15 to 19 years. And answer is B. 10 to 19 years. Question 45. bacteriologically confirmed or clinically diagnosed case of tuberculosis involving pleura, lymph nodes, abdomen, and genitourinary tract is called A. Pulmonary tuberculosis, B. Extrapulmonary tuberculosis, C. HIV positive tuberculosis, D. HIV negative tuberculosis. And the answer is B. Extrapulmonary tuberculosis. Question 46. All of the following infections are transmitted by fecal-oral route except A. Hepatitis A, B. Hepatitis B, C. Diarrhea, D. Poliomyelitis. And the answer is B. Hepatitis B. Question 47. The illness caused by a mosquito bite are all of the following except A. Lymphatic filariasis, B. Malaria, C. Dengue, D. SARS. And the answer is D. SARS. Question 48. Chikungunya virus is transmitted to people through A. Pigs, B. Mosquito bites, C. Chicken, D. Birds. And the answer is B. Mosquito bites. Question 49. A hepatitis D infection occurs only when the person is positive for A. Hepatitis A, B. Hepatitis B, C. Hepatitis C, D. Hepatitis E. And the answer is B. Hepatitis B. Question 50. The infectious disease caused by the variola virus is A. Chickenpox, B. Smallpox, C. Measles, D. Rubella. And the answer is B. Smallpox. Question 51. It involves the usage of manual communication and body language to convey meaning as opposed to acoustically conveyed sound patterns. A. Lip reading, B. Sign language, C. Human aids, D. Technological aids. And the answer is B. Sign language. Question 52. The unique advantage of organizational communication compared to small group communication is that A. Feedback is easier and more immediate, B. Communication roles are more formal, C. Always informal communication takes place, D. All of these. And the answer is B. Communication roles are more formal. Question 53. The nurse is aware that an adaptation of pregnancy is increased blood supply to the pelvic region that results in purplish discoloration of vaginal mucosa known as A. Ladine sign, B. Hagar sign, C. Goodell sign, D. Chadwick sign. And the answer is D. Chadwick sign. Question 54. Suman initiative is covered under which ministry? A. Ministry of Human Resource Development, B. Ministry of Women and Child Development, C. Ministry of Health and Family Welfare, D. Ministry of Education. And the answer is C. Ministry of Health and Family Welfare. Question 55. World Immunization Week is celebrated in the A. Last week of April. B. Last week of June. C. Last week of May. D. None of these. And the answer is A. Last week of April. Question 56. Which of the following best explains how cigarettes cause lung cancer? A. Smoking cigarettes transfer viruses that cause cancers. B. Cigarettes contain nicotine. C. Cigarette smoke contains chemical carcinogens. D. None of these. And the answer is C. Cigarette smoke contains chemical carcinogens. Question 57. In a communication process, noise belongs to which type of barrier to communication? A. Physical. B. Physiological. C. Psychological. D. None of these. And the answer is A. Physical. Question 58. The response received to a sender's message is called as A. Answer. B. Feedback. C. Food bank. D. Encoding. And the answer is B. Feedback. Question 59. FPMIS stands for A. Family Planning Logistics Management Information System. B. Family Planner Logistics Management Information System. C. Family Planning Logistics Management Information Services. D. None of these. And the answer is A. Family Planning Logistics Management Information System. Question 60. The mode of transmission of chickenpox is A. Droplet nuclei. B. Infected blood. C. Mosquito. D. Rodents. And the answer is A. Droplet nuclei. Question 61. All of the following are different forms of diphtheria except A. Nasal diphtheria. B. Laryngotracheal diphtheria. C. Cutaneous diphtheria. D. Systemic diphtheria. And the answer is D. Systemic diphtheria. Question 62. The most effective drug used to treat carriers of diphtheria is A. Azithromycin. B. Erythromycin. C. Doxycycline. D. Tetracycline. And the answer is B. Erythromycin. Question 63. Pertussis is also known as A. Enteric fever. B. Whooping cough. C. German measles. D. Rubella. And the answer is B. Whooping cough. Question 64. Which of the following disease condition is a major cause of mitral insufficiency and stenosis? A. Diarrhea. B. Rheumatic fever. C. Typhoid. D. Malaria. And the answer is B. Rheumatic fever. Question 65. When the causes of hypertension are unknown, it is called A. Primary hypertension. B. Secondary hypertension. C. Isolated systolic hypertension. D. All of these. And the answer is A. Primary hypertension. Question 66. The lifestyle that has a greater risk of developing coronary heart disease is A. Active lifestyle. B. Sedentary lifestyle. C. Active exercises. D. None of these. And the answer is B. Sedentary lifestyle. Question 67. The regular monitoring of blood pressure is under which level of prevention? A. Primordial. B. Primary. C. Secondary. D. Tertiary. And the answer is C. Secondary. Question 68. Which is the following is not a risk factor for the development of diabetes mellitus? A. Sedentary lifestyle. B. Protein energy malnutrition in infancy. C. Excessive intake of alcohol. D. High intake of vitamin A. And the answer is D. High intake of vitamin A. Question 69. National Program NPCDCS includes A. Cancer, hepatitis, cardiovascular and diabetes. B. Cancer, diabetes, cardiovascular and strokes. C. Cancer, leprosy, diabetes and tuberculosis. D. None of these. And the answer is B. Cancer, diabetes, cardiovascular and strokes. Question 70. Which of the following is a major cause of type 2 diabetes? A. Too little sugar in the diet. Lowers blood sugar. B. Obesity. C. Too vigorous exercise. Causes a reduction in carbohydrates in the body. D. None of these. And the answer is B. Obesity. Question 71. Oral hypoglycemic agents may be used to treat patients with A. Ketosis. B. Obesity. C. Dengue. D. Type 2 diabetes. And the answer is D. Type 2 diabetes. Question 72. The diseases covered by the National Vector-Borne Disease Control Program are all of the following except A. Tuberculosis. B. Malaria. C. Filariasis. D. Kala Azar. And the answer is A. Tuberculosis. Question 73. The major initiatives taken under the National Leprosy Eradication Program is A. Dressing materials and supportive medicines are given to leprosy-affected persons. B. Microcellular rubber footwear is provided to protect insensitive feet. C. Rupees 5,000 is provided for persons undergoing reconstructive surgery. D. All of these. And the answer is D. All of these. Question 74. The program that aimed to train health personnel in basic newborn care and resuscitation is A. Rashtriya Bal Swasthya Karyakram. B. Navjat Shishu Suraksha Karyakram. C. IMNCI. D. Home-based newborn care. And the answer is B. Navjat Shishu Suraksha Karyakram. Question 75. What is the proposed timeline for the registration of mothers according to the microbirth plan of Janani Suraksha Yojana, JSY? A. At least 14 to 18 weeks before the expected date of delivery. B. At least 20 to 24 weeks before the expected date of delivery. C. At least 12-16 weeks before the expected date of delivery. D. At least 8 to 12 weeks before the expected date of delivery. And the answer is B. At least 20 to 24 weeks before the expected date of delivery. Question 76. Which of the following can volunteer themselves under the Vande Mataram scheme for providing safe motherhood services? A. ANM. B. Asha. C. Community health nurse. D. Obstetric and gynecologist specialist doctor. And the answer is D. Obstetric and gynecologist specialist doctor. A. 2014. Question 77. The National Adolescent Health Program was launched in the year of A. 2014. B. 2008. C. 2012. D. 2010. And the answer is A. 2014. Question 78. Rashtriya Kishore Swasthya Karyakram (RKSK) has the following 6 priority areas except A. Improve nutrition. B. Enable sexual and reproductive health. C. Address conditions for communicable diseases. D. Prevent injuries and violence. And the answer is C. Address conditions for communicable diseases. Question 79. Which state is called the land of 5 rivers? A. Gujarat. B. Tamil Nadu. C. Punjab. D. Kerala. And the answer is C. Punjab. Question 80. World Health Day is celebrated on A. March 7th. B. April 7th. C. April 10th. D. April 14th. And the answer is B. April 7th. Question 81. Identify these instruments. A. Dialysis machine. B. Mechanical ventilator. C. Portable ventilator. D. Infant incubator. And the answer is D. Infant incubator. Question 82. Which one is more appropriate for preventing acute diarrheal disease? A. Maintaining good personal hygiene. B. Maintaining good food hygiene. C. Maintaining good environmental hygiene. D. All of these. And the answer is D. All of these. Question 83. What is the characteristic feature of vitamin A deficiency? A. Betos spot. B. Koplik spot. C. Cafe au lait spot. D. Target spot disease. And the answer is A. Betos spot. Question 84. Foams, creams, and jellies are which methods of contraception? A. Physical method. B. Natural method. C. Chemical method. D. Intrauterine devices. And the answer is C. Chemical method. Question 85. The objectives of family planning are all of the following except A. To bring about wanted births. B. To regulate the number of children in the family. C. To minimize the interval between pregnancies. D. To avoid unwanted births. And the answer is C. To minimize the interval between pregnancies. Question 86. Which of the following is a terminal method of contraception? A. Birth vaccine. B. Vasectomy. C. Subdermal implants. D. Combined pills. And the answer is B. Vasectomy. Question 87. Preventive methods to help women avoid unwanted pregnancies are called A. Family planning. B. Contraceptive methods. C. Small family norm. D. Couple protection. And the answer is B. Contraceptive methods. Question 88. When diarrhea lasts for more than 14 days, it is called A. Dysentery. B. Acute watery diarrhea. C. Persistent diarrhea. D. All of these. And the answer is C. Persistent diarrhea. Question 89. Which of the following national programs were implemented through the Department of Parasitic Diseases of NCDC? A. Guinea Worm Eradication Program. B. National Rabies Control Program. C. Guinea Worm Eradication Program and National Rabies Control Program. D. Program for Prevention and Control of Leptospirosis. And the answer is A. Guinea Worm Eradication Program. Question 90. It is the ability to make logical, rational decisions and decide whether a given action is right or wrong. A. Judgment. B. Controlling. C. Creativity. D. Interpretation. And the answer is A. Judgment. Question 91. The state in which the famous Ajanta caves are situated in: A. Madhya Pradesh. B. Maharashtra. C. Gujarat. D. Kerala. And the answer is B. Maharashtra. Question 92. Which is the most popular classical dance form in Andhra Pradesh? A. Bharatanatyam. B. Kathak. C. Kuchipudi. D. Mohiniyattam. And the answer is C. Kuchipudi. Question 93. A postpartum woman should be instructed to perform the Kegel exercise for which of the following purpose? A. To promote uterine involution. B. To prevent urinary tract infection. C. To strengthen pelvic ligaments. And the answer is D. To strengthen the pelvic floor muscles. Question 94. A primigravida mother delivered a male baby. The newborn has visible secretions after birth. The nurse has to suction the newborn in which of the following method? A. Nose first followed by mouth. B. Mouth first followed by a nose. C. Mouth only. D. Nose only. And the answer is B. Mouth first followed by a nose. Question 95. Identify this instrument. A. Artery forceps. B. Alice forceps. C. Green Armitage. D. Babcock forceps. And the answer is D. Babcock forceps. 96. While administering the enema, patients should be placed in A. Sims position. B. Supine position. C. Mid-Fowler's position. D. Knee chest position. And the answer is B. Supine position. Question 97. Facility-based counseling centers provide health education to adolescents in all of the following areas except A. Nutrition. B. Puberty. C. Prevention of STD. D. early marriage and childbearing? And our answer is D. Early marriage and childbearing. Question 98. A nurse working with adolescents in juvenile homes discusses the developmental task appropriate for adolescents with a caretaker. An example of a primary developmental task of an adolescent is A. Working hard to succeed in studies. B. Accepting the decision of authorities. C. Developing athletic activities and skills. And our answer is D. Spending time developing relationships with peers. Question 99. Which position is demonstrating here? A. Recovery position. B. Sims lateral position. C. Dorsal recumbent position. D. Knee chest position. And our answer is A. Recovery position. Question 100. To perform nasopharyngeal airway suctioning for a conscious patient with a functional gag, the nurse should place the patient's head in which of the following positions? A. Chin flexed to chest. B. Face towards the right shoulder. C. Face towards the left shoulder. D. Neck hyperextended. And our answer is D. Neck hyperextended. इससे संबंधित अधिक जानकारी के लिए हमारे चैनल को सब्सक्राइब करें। धन्यवाद।